What's going on, everybody? Happy New Year's Eve. Welcome to Political Fight Club. I'm Robert Durden. We're going to continue with Dreamland today. I hope you guys are going to have a happy holidays. Please be safe out there. Figured we'd just read about half a chapter here. It's a very long chapter. Page 247, More Cases Than Car Crashes. Southern Ohio. The gaunt addict known as Jeremy Wilder from the town of Aberdeen on the Ohio River left prison and came home in 2007. He was locked up in 2003 for breaking into pharmacies, his addiction out of control. When he left Aberdeen that year, the town possessed a small group of drug addicts to whom he sold his OxyContins. Now, 4 years later, his brother and everyone he knew was heading to Florida to buy pills. But things had gone far beyond pills. Many people in Aberdeen were on heroin. They wandered the small town half dead, proud of their needle marks. When I was selling oxys, it was a certain group of people, he told me. When I come home, it was a certain group of people plus everybody else, cops' kids, poor kids, rich kids, smart kids, dumb kids. The area had spawned a generation of young people who had nothing to look forward to, whose families had been unemployed for years. Many of these kids grew addicted. But kids at the bottom were not who moved the market. It was really the rich kids who did that. Jeremy sold to two brothers whose parents were well-off business owners in town. Another customer was going to inherit several houses. From his place on the Ohio River in 2007, Jeremy Wilder could see the change. First pills, now heroin. Lots of both. But it was nothing anyone in the official position in Ohio recognized. As luck would have it, some data passed across the desk of a guy in a state office cubicle up north in Columbus who liked being alone. Ed Sosi loved numbers. Sosi was an epidemiologist with Ohio's Department of Health. He worked on the 8th floor of the department's building in Columbus in the Violence and Injury Prevention section. He followed data of deaths from violence and injuries. By mid-2005, he had been at his job for 22 years. An admittedly reclusive fellow, Sosi was fascinated with statistics and data and the stories hidden beneath them. He possessed enormous curiosity for the topic. I just sat at a computer all day crunching numbers on death data, he said. I enjoyed crunching those numbers. Out of curiosity, I looked at everything I could. By 2005, Sosi was supervising data for a lot of hot-button topics. Among them were homicides and suicides, which rose and fell with some frequency. One number he counted on to stay put, however, was deaths from accidental poisoning. People just didn't poison themselves to death all that much, nor did the numbers vary much from year to year. So in 2005, Sosi was startled to notice that poisoning deaths in Ohio were climbing. His data came from the Federal Centers for Disease Control. Ohio coroners' death certificates are submitted to the CDC, which codes them according to cause of death and sends the figures back to the state for easy evaluation. His data came from the it all began with the figures for unintentional injury deaths. Sitting at his desk one day, Sosi saw the deaths coded for unintentional injury were headed up. He dug further and found that most were coded as accidental poisonings. Why would they be rising? Intrigued, he kept digging into the CDC data and codes. The poisoning deaths, it turned out, were actually drug overdoses. This was new. Cocaine and methamphetamine, the popular drugs through the 80s and 90s, are damaging drugs, but people don't often fatally overdose on them. Heroin, which people do overdose on, hadn't been a sustained problem since the 70s. Drug overdoses in Ohio had remained pretty constant for decades. Sosi graphed these new numbers. After remaining stable for decades, the deaths suddenly took off like an airplane, almost tripling in 6 years. A good chunk of the deaths, known in CDC coding as X44s, were due to quote-unquote unspecified drugs. But an equally large segment, the X42s, were from narcotic overdoses. Sosi began running his computer through its paces, asking about deaths from specific drugs: oxycodone, hydrocodone, heroin, cocaine, morphine, opium. Opiates were present in virtually all the deaths where the drugs were specified. The numbers alarmed Sosi. He showed them around the department. At first, his work fell upon deaf ears, he said. I got no feedback this was something I should explore further. I was a little disappointed because I thought this was important. Sosi bided his time, watching as the numbers kept rising over the next 18 months. In January 2007, Chrissy Beagley took over as the supervisor at the department's Violence and Injury Prevention Unit. Beagley was from a children's hospital where kids were injured from what was under the sink, not so much from what was in the medicine cabinet. But maybe it helped that she was not an old hand at violence and injury prevention. Sosi brought out his data and charts showing the sudden increases in fatal drug overdoses. 95% of all Ohio poisoning deaths were drug overdoses. The greatest part of these overdoses was due to prescription pills. Beagley was astonished. They dissected the numbers further. That's when they realized, right then and there, drug overdose deaths were about to surpass fatal auto crashes as Ohio's top cause of injury and death. This was a stunning moment in the history of the U.S. public health. Since the rise of the automobile in America, vehicle accidents sat unassailed atop a list of causes of injury death in every state, and in the United States as a whole. Now, Ed Sosi's numbers showed that would no longer be true in Ohio, and by the end of 2007, it wasn't. That was a really startling trend, Beagley said. It took the pills to get us here. We've exposed a much greater population to these opiates than we had back in the 70s with the heroin epidemic. Drug overdoses passed fatal vehicle accidents nationwide for the first time in 2008, but it happened first in Ohio, where two complementary opiate plagues met and gathered strength in the late 1990s. Prescription painkillers, especially Purdue's OxyContin, moving east to west, and the Jalisco Boys' black tar heroin moving west to east. The effect showed up a decade later in the death numbers Ed Sosi untangled. Sosi and Beagley also found that quantities of prescription painkillers dispensed annually in Ohio followed the same upward line as the overdose deaths. Both rose more than 300% between 1999 and 2008, but even that hid the truth. The use of some opiates actually declined, codeine for example. The real story was in what skyrocketed: oxycodone. Dispensed grams of oxycodone, the only drug in OxyContin, rose by 1,000% in Ohio during those years. They wrote a report revealing once camouflaged facts. 1. The number of Ohioans dead from drug overdoses between 2003 and 2008 was 50% higher than the number of U.S. soldiers who died in the entire Iraq War. 2. 3 times as many people died of prescription pill overdoses between 1999 and 2008 as died in the 8 peak years of the crack cocaine epidemic. And 3. In 2005, Ohio's overdose deaths exceeded those at the height of the state's HIV and AIDS epidemic in the mid-90s. Down in Portsmouth, a doctor named Terry Johnson wasn't surprised. By 2008, Johnson had been a Scioto County coroner for 6 years. He was a family doc and untrained in forensic medicine. But family doctors in small towns often take on responsibilities of a coroner. Johnson was elected to do the job in 2002, just as pills were washing across his county in numbers sufficient to create an OxyContin economy. He was still trying to figure out what a small county coroner did besides assigning a cause and manner of death when a deputy called one night. "We got what looks like a drug overdose, Doc," the deputy said. "Don't know what you want to do. You don't have to come out if you don't want." Previous coroners hadn't. "I thought I probably should go out," Johnson said. At the scene, he found a man dead with a needle in his arm. Fatal overdoses came regularly after that. The office had a small budget, and dead junkies would have been easy not to autopsy. But Johnson sent the bodies to medical examiners in larger counties better prepared to do full autopsies and blood tests. These invariably turned up opiates, usually combined with benzodiazepines, the old Dr. Proctor cocktail. Johnson is a trained osteopath, a discipline focusing on holistic approach to health. He had once convened a summit of Scioto County doctors, pharmacists, and elected officials to address the new and aggressive opiate prescribed for chronic pain. Nothing had come of it. Now pill mills swept across his city. Fatal drug overdoses increased every year. He saw the lines outside the pill mills and the junkies wandering down Highway 52 to Walmart. He watched capable young people get themselves declared simple, quote unquote, to get SSI and the Medicaid card, and thus access to pills. Johnson began tabulating what he termed drug-related deaths, a death that probably had to do with the person's addiction, but that was officially deemed, say, a heart attack. When he did that, the numbers doubled. By 2008, Scioto County had 21 fatal drug overdoses and 23 drug-related deaths, giving it the second highest death rate in the state. Yet in Columbus, the legislature had other concerns. The Ohio boards governing the licensing of doctors and pharmacists, believing their hands tied by the state's intractable pain law, kept silent. Had the boards been the slightest bit creative, they could have put a stop to this. They could have put the pill mills out of business, Johnson said. I was trying to bend our prescribing habits down. What I was fighting was a multi-million-dollar ad campaign to liberalize prescribing. Then the epidemiologist showed I was right. But no one was looking at it until the State Department of Health realized our numbers exceeded fatal traffic accidents. All right, we'll finish the chapter tomorrow, guys. We're on page 251. Keep fighting that good fight out there.